March of this year, I had open heart. It failed, and I was at Vanderbilt before I came here because it was just too far to drive. We got transferred here. And once I got here, I was on deathbed then. At first, they told me there's nothing they could do with a single LVAD, but I'm totally on artificial heart now.
Pedigo, a few days right before his admission to the hospital. It's an interesting story. One of my colleagues from Vanderbilt University called us and said that they are treating a patient right now who has a true end-stage heart failure, who does need advanced heart failure therapy. And they weren't aware about access to therapies here in Memphis, and they asked if we can accept that patient to evaluate him for one of the options that they have there and we do have available here. We certainly agreed, and then I met Mr. Pedigo after his discharge from Vanderbilt University. At that point, Mr. Pedigo was extremely sick, and at that time, right away, he was admitted to the hospital. And that's the first time I started treating him.
In March, I had open heart surgery, and about the 1st of April, I started going downhill pretty quick. And by the time I got here, I was really sick, and I wouldn't have made it through another night, I don't believe.
We see lots of patients like Mr. Pedigo here, and right away, just knowing his past medical history, seeing how he presents and how debilitated at that point he was, I knew that his prognosis is extremely poor. I wasn't at that point sure that he can actually wait or make it through the surgery.
I've had numerous heart attacks, numerous stents. I was dead for 45 minutes. That was a massive one. But they got me back and got me well. And then day by day, it's got worse.
Well, we basically replaced his heart with 2 artificial pumps, kind of internal electric pumps. The thing is, these new pumps are quite small, and we need to create a space holder where the former heart was, so the space will be preserved for a future heart transplant procedure.
That wasn't a decision right there on the spot. It's a well-calculated, a team decision. Right at that point, I realized that Mr. Pedigo does need to be seen by the whole advanced heart failure team here at Baptist. And at that point, I called the whole team to his room, and that's when we started evaluating Mr. Pedigo.
They replaced a couple of the vessels, but it had failed. And while I was at Vanderbilt, they put 2 stents in to fix that, and they had put a defibrillator and a pacemaker in. That worked there, but I just kept, my heart just couldn't take it no more.
So how many times have they opened up your chest?
That's to be twice.
It's rare, because usually we do all kinds of things in our power to support a heart and not to replace it. But it comes to the point that the heart is failing in a way that you cannot support it anymore. And then you cannot do so much. And then this is one of the ways to replace the heart.
Once the team got together, and then Dr. Harrison, Dr. Struber evaluated the patient, it was agreed upon that surgery is the best and the only therapy for him that can prolong his life.
So is that the battery that's attached to the...
Yes, sir. It's just two monitors and batteries.
So these are the batteries, is that correct?
Yes, 2 batteries per bag.
So are they attached to you now?
Yes, they got a drive line, goes in here.
So that line I see coming out is actually going under your jacket and it's attaching to something that
it's going in right here.
Wow.
It's sending the electrical pulses.
So you have to carry that all the time?
Yes.
Basically?
Everywhere I go, it's got to go with me.
So Mr. Pedigo right now discharged from the hospital, and he's doing well in his first visit here today. The goal for us is to get him better and get him stronger so he can be a candidate for a heart transplant. And right before we saw him, we agreed with our colleagues from Vanderbilt that at that point he wasn't suitable for a heart transplant, but we're hoping that within the course of next weeks or month at the most, he will become a candidate for a heart transplant.
And how you feeling?
Oh, I feel great. I feel real good.